Hi, Shan Orthopedics here. So this video is going to be in English, but there will be subtitles available in my YouTube channel. Now, I'm going to talk about a common condition which might appear trivial but causes a lot of distress to a lot of people because it does not go away. It tends to happen again and again. I'm talking about onychomycosis or fungal infection of the nail. You've probably seen some elderly people having it, probably seen some children having it, seen it happening around the toes, the big toes especially, or also in your fingernails. Now, why is this happening? Why is it happening again and again? And how we can treat this in a more effective way? This is the main purpose of this video. So I do hope you learn something more than you already know about fungal infection. So fungal infection of the nail happens because we create an environment for the fungus to set in, and we create a very low barrier for our body to fight this infection. So what do I mean by this? For fungal infection to set in, you need to create an environment which is warm, moist, and a slightly alkaline pH to the environment for fungus to grow in. If you have injury to your toenail, on top of all this, you can also invite the infection to set in easily. Now, if your foot hygiene is poor, which means you're wearing tight shoes, you're not wearing socks, or if you're not changing your socks often, you are predisposing yourself to fungal infection. Now, the other concept that I said earlier is the barrier. The barrier is basically our immune system. The ability of our immune system to attack this organism can be lowered in conditions such as diabetes, if you're taking long-term antibiotics, if you're taking long-term steroids, if you have immunosuppressive disorders. All these will lead to fungal infection from setting in and staying there for a long period of time. So, in order to treat this infection effectively, you need to take certain precaution. If your nails are thick and they are deformed, you might want to shave them before you apply the antifungal, so the antifungal can effectively reach and kill the organisms. In a very bad case where it is deformed, you might need to remove your nail plate and continue the antifungal for a long period of time. And in very minute cases, an oral antifungal might be the choice of treatment, but this is usually not recommended because it has a lot of complication associated with it. So along with this antifungal that you're taking, you need to make sure that you don't create the environment for the fungus to set in, and you need to make sure that your immune system is optimal, which means treat your systemic condition, take multivitamins, especially if you're low in certain vitamins such as vitamin D, and make sure that you take your antifungal treatment for a long period of time. So this is how we can have a better chance of treating onychomycosis, and I do hope that this video helps you in your road to recovery. Thank you.